necrotic tissue, proximal tissue tension, obliteration of dead space use of safety technique, and then he's definitely credited with probably starting the first surgical residency at Johns Hopkins in the 1800s, and then modernizing surgical training. So what is the importance of these surgical discoveries in surgical care? I think the biggest importance is that you increase the availability and accessibility of surgical care. You can target with training programs and accreditation, improve quality of care. And you can see that the quality of surgical care in the 20th century and 21st century, there's some changes in morbidity and mortality for surgical-based diseases and improvements over that time frame. And then obviously promotion of innovation, because with complex surgical care delivery based on those three discoveries, you can support innovation. For public health, I really try to focus on what are the modern era achievements and what achievements are specifically looked at as significant achievements in the public health arena. And these include things like immunizations to help combat communicable diseases worldwide. Immunizations such as polio vaccination in 1954, smallpox vaccination, which was implemented in 1966, and I think they achieved eradication in 1977. Life expectancy increased over the last century or century and a half of 20 to 25 years, and since 1960 probably an increase of 9 years, even though that's specifically in the United States, and there are other countries that have exceeded that, but that's a significant achievement. Then other things like motor vehicle safety, workplace safety, control of infectious diseases, safe and healthy distribution of foods, Food and Drug Administration is another example. Healthy mothers and babies, decrease infant mortality rate and complications post-delivery, fluoridation of drinking water, and decline of mortality associated with cardiovascular diseases and cerebrovascular disease. So from a global public health standpoint, in the 20th and 21st centuries, we often talk about communicable and non-communicable diseases. The ones that you probably hear about the most would be HIV and AIDS, malaria, tuberculosis, smallpox, and polio. But non-communicable diseases are becoming a more predominant issue that we are faced with on a daily basis. There's a lot of discussion of this as an epidemic in high-income countries, but I think that with globalization and connection with technology and distribution of a lot of different technologies and advances, that this is something that not in the too distant future will be a problem worldwide. And then there's obviously glaring disparities in global healthcare. There's still a significant number of countries, low-income countries, and low-middle-income countries that are suffering from these disparities. So the World Health Organization, which was created in about 1948, was created by the United Nations, and they, at the turn of the millennium, created the Millennium Development Goals. I don't know if many of you have heard of these, but this was their attempt to combat poverty, hunger, disease, and illiteracy, and improve outcomes and access to healthcare for many of the areas of the world that are experiencing these different disparities in healthcare delivery. So there's 8 goals that were developed, and the reason I put this up here is because I think what's important is that when you look at this, you don't directly see surgery listed within the goals, but goal 4, 5, and 6 definitely have surgical-based funding and surgical-based needs in order to improve those outcomes. And I think some would even argue that goal 1, based on delivery of adequate surgical care and even basic surgical care, would significantly improve, and mostly the extreme poverty, maybe not as much the hunger. So, is surgery a public health intervention? When we talk about public health, a lot of people focus on communicable diseases, vaccinations, treatment of infectious diseases. But I think when you talk about public health, you have to understand that there's different types of prevention. Primary prevention, which is common public health focus, is one that you hear the most about. But secondary and tertiary prevention of disease is is something that, like I said, in the late 20th and 21st century is at the forefront. And while it's a disease of high, middle, and low income countries, I think that what's important is that we have to make sure that we recognize this as a priority in global public health and continue to strive to improve delivery of care. I would even argue that primary prevention is seen from our standpoint. We see that on the trauma service a lot through education and delivery of preventative measures, and so there is primary prevention that's necessary from a surgical delivery standpoint. So what are the keys to surgical success? I think the biggest keys are access, development of roads in some areas of the world, clinics and hospitals. In the United States, we know that there's going to be a shortage of physicians in the next 20 years, but throughout the world there's already a significant shortage of physicians. And I think ours is 2.5 physicians per 100,000 population, and there's a lot of places where it's much, much less than that. Appropriate delivery of appropriate care. Does the care meet the individual needs of the community? Each community is slightly different in their needs, and an assessment of what they need is important prior to establishing care. Availability. I think that's one of the big disparities, that regardless of age, gender, race, and income, you have to make this care available to people that are suffering from surgical diseases. And then affordability. That's probably one of the biggest challenges, is trying to transition care that we know is very expensive and can cost on average somewhere between $6,000 to $9,000 per patient in the U.S., and try and deliver that to somebody who's making close to $1.25 a day. It's a tough barrier to overcome. So understanding the burden of disease, I think when you're talking about public health and you're talking about disease burden, it's important to understand disability-adjusted life years, or disability-adjusted life years averted. This is how most of the communication is done in the literature to understand the burden of disease. It gives you kind of a cost-benefit analysis and an impact on, and it can directly correlate or give you some idea of the impact on national and international economy. So disability-adjusted life years is usually calculated by years lived with a disability plus years of life lost. And this is a simplified version of the calculation. They modified this to be weighted depending on different factors, but this gives you the basic understanding, and you can see the picture there. And the importance of this, like I said, is that you want, within a given population, to make sure that you are able to steer away from these two things in order to ensure that the society is successful and able to support itself economically and flourish. So to put it in perspective, you can see that interventions such as intervention of rapid impact packaging and that's neglected tropical diseases. These are a significant morbidity throughout the world and supported by the Bill and Melinda Gates Foundation. But in excess of probably 1 billion people, 1.5 billion people suffer from these on an annual basis. And so you can see the cost effectiveness of delivery of care, which is medicine, is somewhere between $2 to $9 per daily or per disability adjusted life year averted, which is, when you talk about that, the long-term impact, that's a low cost with a significant outcome. Measles vaccination is $5 per disability adjusted life year averted. And then the reason I put this up here is you can understand that basic surgical services, which is somewhat ill-defined but important, the cost is not that much different. You have a US $11 to $33 per daily adjusted life year averted. So it's, I would argue it's affordable and something that is essential. And then antiretroviral therapy for HIV, which is US $300 to $500 per daily disability adjusted life year averted. So what are some of the misconceptions? I think that the global burden of disease is non-surgical. That it's been identified probably since the late 1900s, 1980, 1990, that surgical disease is important, but world organizations have not gone about addressing it and not considering it as a direct public health issue. So it's a little bit of a misconception. That surgical intervention is too expensive. I think that that's a misconception of the Western world and driven by economic policy. So it's something that I think you can provide some of the basic essential surgical services at a reasonable cost. And then surgical burden of disease is not a national concern. So to give you some more perspective and some of the truths is that traumatic injuries, for example, 90% of injuries occur of traumatic injuries occur in low and middle income countries. Yet only 3.5% of world operations occur in these regions, and there's approximately 245 million operations that occur annually. Cervical cancer is another example. 85% of cervical cancer occurs in low and middle income countries, and about 300,000 women die of cervical cancer each year. And then another would be infectious diseases that maybe have surgical treatment options, including H. pylori, hepatitis B, Hep C, and HPV, common worldwide, and associated with stomach, liver, and cervical cancer, and can be lethal. So I chose to pick one of the more common and easily accessible and modifiable conditions, and that is related to trauma surgery. Because traumatic injuries are very predominant, especially in countries that are of lower income and some of the early industrialization countries. So the World Health Organization and International Association for Trauma Surgery and Intensive Care created a project in 2004 called the Essential Trauma Care Project. They were able to perform a needs assessment of 100 different rural urban hospitals, and this was located in 4 low middle income countries. Specifically Ghana, India, Mexico, and blanking on the 4th one. But they were able to identify 11 core essential measures, and these are the measures listed here. Now, some of these may seem very straightforward, but based on these 11 measures, in each individual country, they were able to have some sort of improvement in the disability-adjusted life years suffered from traumatic injury. So things as simple as airway appropriate management of airway would include things like checking airway and sweeping airway for foreign objects, things like that. Bleeding, stopping external bleeding, internal bleeding. I know like shock may be a difficult thing to treat in some hospitals due to lack of resources, but following these guidelines and setting up a formal delivery of care based on surgical input could significantly improve morbidity and mortality from traumatic injury. So another example created about a year later by the World Health Organization was a program called Emergency and Essential Surgical Care Program, or EESC. This program has a biennial meeting, and it's a multidisciplinary meeting that includes professional societies, health authorities, public health experts, non-governmental organizations, and international organizations. And really, the purpose of this meeting is to address the disparities that are seen within surgical care and emergency care and delivery of services. And they've gone about providing research-driven education and policies, and significant access to free resources to anybody that's willing to obtain those resources. So one example is District Hospital Manual, which is about a 350-page manual that really goes through the basic fundamentals of delivery of emergency and surgical care, including simple things like suturing, how to approximate the wound. I mean, most of the things that we see in the simulation lab, and they provide this, so you can provide it on a disc. It's all free or downloaded PDF, which I know that a barrier for some places would be technology, but it's something that you could deliver to those places. So this is a list of their primary objectives, and this is their brochure, and that timely access to surgical care saves lives and prevents disability. So as diabetic complications, treatment of cancer, injuries, violence, disasters, pregnancy-related complications, congenital anomalies, infection, and other surgical conditions. So why is this important? I think it's important because surgical disease, based on recent studies, is estimated to account for approximately 13% of disability-adjusted life years worldwide. And that's a pretty large percentage if you think about it. 11% of global burden of disease is probably attributed to surgical disease processes. And surgical disease is known to account for more deaths or more mortality than HIV, tuberculosis, and malaria combined. And there's a substantial financial commitment to treatment of these three diseases as compared to surgical disease processes. There's also a surgical workforce crisis. We know that there's a shortage of 4.3 million surgical personnel worldwide, which is not an easy thing to address, but it begs the need to train people, and maybe not just MDs, but a lot of other mid-level and other healthcare providers to try and address simple surgical issues. Addressing disease burden. So unfortunately, the low middle income countries probably have differing distributions of surgical disease process, but I think that they bear a significant brunt of untreated disease. And one of those, as we've discussed, is traumatic injury related, and those include things as road traffic accidents or injuries, and these are often the most common source of disease burden. And providing access. So I think it's important that we provide training, education, and information to try and better these processes throughout the world. So the World Health Organization then commissioned a project that's been ongoing for the last 2 decades. It's called the Global Burden of Disease Project, where initially it was established in 1990, and the idea was to get some sort of assessment worldwide about the distribution of disease and the burden of disease in different populations. And that was based off of the classification of the disease. They revised that in 2002, and then again in 2010, and they can be attributed with creation of this measurement of disability adjusted life years in order to compare different disease processes across population. But I think the most important thing is that during the latest revision in 2010, comparison of disability adjusted life years averted was compared by specific interventions. So now surgical intervention and surgical disease had more of a role in the public health community because you could see specific effects of intervention. The other thing is that it creates a significant database to drive research-driven changes in the global burden of disease. So this chart gives you an idea of the burden of injuries, and this is specific to traumatic injury. But you can see that on the y-axis, you've got disability-adjusted life years in the tens of millions, and then on the x-axis, which I realize it's small, because it's a big chart, you have different types of injury. And so you get an idea of the number of disability-adjusted life years that occur internationally, and this is specific to low and middle income countries. And so the yellow bars tell you that these are the things that they predict are avertable by surgery. So these are the number of disability life years that you can affect by surgical intervention. And so you can see, like the first one is road injury, and it's in excess of 10 million. It's probably 15, 16 million. There are some that are not, like poisonings, self-burn. They felt like that was not avertable. But other things, which include falls from standing, which we see plenty of that, and then interpersonal violence is another one. So there's also a role for specialists in international and treatment of global burden of disease from a surgical standpoint. From Europe, urologists, benign prostatic hypertrophy is a common and leading cause of obstructive neuropathy and kidney disease worldwide. To give you an idea, sub-Saharan Africa is estimated to have 818 million people, and worldwide, I think about 140 to 160 million males suffer from this disease process annually. But there's only one urologist per 10 million people in this location. So obviously treatment of this disease is an issue and leads to significant burden of disease for the individuals living in this specific location, but also other parts of the world. Obstetric care is another one. You have very common is vaginal fistulas after delivery, whether they're colovaginal fistulas or vesiculovaginal fistulas, and obstetric trauma, and then delivery of children with congenital defects. It's also something that is difficult to deal with. Orthopedics, there's a significant role, and that's based off of what I talked about with traumatic injury, specifically road traffic accidents and road traffic injuries. And then ophthalmologists can deliver cataract surgery. Actually, cataract surgery has been developed significantly in that it's sutureless surgery, and there's a lens developed that you can deliver for a very low cost. It's like, I think, $4 per disability adjusted life years. So it's a very cost-effective treatment. And the number of people that suffer from blindness is around 130, 140 million annually. And I think 30 to 40% of that is due to cataract alone. So it's a treatable disease process that has a low cost. It can have significant effect. And then plastic surgery, we've all heard about cleft lip, cleft palate, and Operation Smile. And this can make a significant improvement in the quality of life of young kids. So what does surgery provide? I think it provides minimizing the disabilities of the young, which is important for the well-being of society and specifically of nations. It also maintains and improves the quality of life of the elderly. It helps communities prevent and treat chronic diseases, disabilities, and assists in maintaining a strong local and national economy. So what can you do? I think this is really, when you look at this information and when you look at the wealth of information available, you often sit back and think, this is above my pay grade. This is something that I'm not sure I can make a difference. But this is where I think that it's important, especially as you're going through your training, that you understand that there's things that you can do to help improve the overall well-being of the human condition. And that is things like medical missions. And this is one of the more, as far as impact factor, it's maybe not the best, but it's something that you can do immediately and get involved in. You can provide education with those resources I listed. There's access to all of this stuff through the World Health Organization, and you can educate people at the local level, and you can provide quality surgical care and at least temporary access to surgical care, maybe annually or biannually, depending on how often you participate. Policy advocating. You can advocate for policy change and promote investment in change. Foundation grant application. There are numerous foundations and organizations throughout the world that you can apply for grants and grant money if you can prove there's a need, and they will support that and you can establish that. So establishing things like hernia clinics, cancer screening centers, like Aplin has proven to be an effective cancer screening method, and that can easily be employed. And then education, again. And then the last would be research. There's actually an Institute for Health Metrics and Evaluation out of Seattle, Washington, the University of Washington, that has collected a large amount of data and free data on the burden of disease and different disease processes that you can use to generate research. So I'm just going to transition a little bit to, it's almost done, to my personal experience, and that's with the Midwest Medical Mission. There's actually several different chapters of this, but this one is based out of Toledo. And it provides missionary services to the Dominican Republic, San Pedro and Santo Domingo. And it's 4 weeks of service that they provide annually. So they provide 3 weeks, 3 continuity weeks in February and 1 in October to the population in this region. And they, on average, for the week that you're there, do about 90 operations, and they see somewhere between 700 to 1,000 people during that week for different ailments. And we're able to provide education to local physicians and medical professionals in a different training arena and help bring them up to speed on current management. They collect supplies, and they usually collect supplies via the hospitals that you guys work at. So if a gown's open but not used, they'll collect that because it's thrown away anyway. Different medications that are donated and unused medications, and then that is usually transported by the individual in some sort of duffel bag to the location where the mission is. And then surgical instruments are another thing that's collected. These are gently used surgical instruments, and you bring your own instruments with you. So here's a picture. That's me in the pink because it's Valentine's Day, and if you're a junior member, they make you wear pink scrubs.
You wear
that. Dr. Amir. What's that?
You wear that.
Yeah, every day. Yeah. And that's Dr. Amir, who was there as well. He goes usually every year. This is an idea of the supplies that we brought. So it's an extensive amount of supplies that are packaged. Those are actually packaged by the team, so they put together their own packs of what they need. But these are all unused supplies, and you can get an idea of the amount of supplies that we just kind of discard that can be used. And the quality of the surgical operating theater, but you make do with what you have. This is day one, so this is a panoramic shot, and the clinic is bigger than this, and the hallway is literally packed with people, and all these people want you to do something for them. And this is just for surgical evaluation for treatment of surgical diseases. So this is not the line that is for treatment of medical issues. And then providing lectures. This is one of the physicians that came along providing lectures to the local health experts and residents. This is hydrocele that I got the pleasure of treating. An individual that had been suffering for years with this. He actually traveled from Haiti to come get this taken care of. Open cholecystectomy, hernia repair. So all of these things are common and need treatment. And then obviously the last is enjoying some personal time at the end of completion of mission, but get to see some beautiful areas as well. So in conclusion, I think surgical training is probably, in my opinion, the best training you can get. I mean, no offense to other people that are going into medicine and stuff, but I think that it offers you a unique set of skills. And global surgical landscape is rapidly changing, as you can see. So I think it's important that you donate your time and expertise and enjoy your vocation.
That's very good, thank you. Yeah. One or two questions for George. This is the lecture.
Yeah, awesome.
I just want to say thank you for the presentation and certainly